So normally in examination you find question about these different centers, organization, setup and functions of these centers. Okay. So we will start from the health services at village level, from lower level, and we will proceed to upper level. Okay. The health care delivery system in rural area is divided into following levels. Which are those? The health services at village level, health services at sub-center level, health services at PHC level, and health services at CHC level. Okay. So this setup can be seen in every state. First we will start how we provide services at village level. So at village level, health services are provided by 2 link workers. Okay, because in each village the workers attached to health department cannot reach. Okay, because the staff is posted at sub-center level, and under each sub-center there may be 4 to 5 villages. So to provide health services at village level, we have to take the services of link workers. Okay. So these link workers are Asha worker and Anganwadi worker. Okay, we have 2 link workers through which we provide health services at village level. Asha worker is connected to health department, while Anganwadi worker is connected to ICDS department. Okay, clear? So many times in examination it is asked that to which department or which scheme Anganwadi worker is attached. She is attached with the ICDS scheme. Okay. Both workers work in villages up to the population of 1000. Okay. Normally, officially population to work with is 1000 for each worker. Okay. Sometime it may be more. Okay. And if the village is bigger, it has population of more than 2000, then 2 workers may be posted in one village. Okay, so this is a standard system of Asha and Anganwadi. Both workers help ANM, okay, of that sub-center, okay, under which those villages are attached. They provide necessary help to ANM and work as a link between health system and the community. Okay, that's why we call them link workers. Okay, Anganwadi worker and Asha worker both are selected from same community. Okay, it means they promote community participation because they are from the same community, same language, same culture. Okay, so they are the person whom people trust. Okay, they help ANM in immunization and health related survey in the village. Okay, they accompany them. Asha and Anganwadi worker also help the ANM in national health programs. Okay, so for all national health program we can take help from Asha and Anganwadi workers for registering antenatal mothers and providing antenatal care as well as postnatal care to the mothers. Anganwadi worker is also connected with the supplementary nutrition to pregnant women and children. Okay, they also assist. Now, what services are provided at sub-center level? Okay, so sub-center level is the grassroots level health setup of government department. Okay, for each state. Okay, as you know, one sub-center provide health services to 3 to 4 villages which are under these sub-centers. Okay, if we discuss about staffing pattern, so normally one health worker female and one health worker male is attached to one sub-center, and health worker female is also known as ANM and health worker male is also known as MPHW, multi-purpose health worker. But after NRHM, which was launched in which year? 2005. The MPHW post is finished, and it is advisable that each sub-center should have 2 ANMs. Okay, so male post is abolished, so 2 ANMs should be attached to one sub-center and they will provide the health services. What services are provided by this ANM? Because as we have already discussed that at least primary health care services should be provided. So all the 8 points or elements which we have already discussed, those services will be provided by the sub-center, and each sub-center normally covers the population of 3,000 to 5,000. Okay, 3,000 in hilly, tribal and backward areas and 5,000 in normal plain areas. Okay, so this is the organizational setup of sub-center. What functions are done? This question may come in exam. Write the functions of sub-center. So if we know about primary health services or primary health care, we can write this answer also. Okay, so all points we can write here. Functions of sub-center include maternal and child health services, MCH, including family planning, immunization, safe abortion, safe drinking water, basic sanitation, implementation of national health program, survey, data collection and community need assessment. So these all services are already we have discussed in the primary health care. Okay, including one more topic you can write here, health education. Okay, health or spread of health awareness, that we can write. Now what is primary health center? So primary health center is higher to the sub-center. Okay, so primary health center is a health facility which covers the population of 20,000 to 30,000. Okay, 20,000 again in hilly, tribal and backward areas and 30,000 in normal plain areas. PHC has the capacity of 6 beds. Okay, at sub-center there is no bed capacity, but at PHC we have 6 beds capacity for any emergency arises. But normally at PHC we do not admit patients. Okay, it is OPD. Services are OPD based. Okay, normally no IPD services are provided. But in some upgraded PHCs, IPD services may be provided, but otherwise only OPD services are provided in PHCs. Clear? And one PHC covers the 4 to 5 sub-centers. Okay, so the 4 or 5 sub-centers, normally 4 sub-centers are there under one PHC. All the ANMs which are working in those sub-centers will report to the medical officer of PHC. Okay, he is the in charge of that area. If we see staffing pattern, so officially as per government standard there should be approximately 15 staff in one PHC. Okay, which may include one medical officer, one nursing officer or staff nurse, pharmacist, ANM, block extension educator, health assistant male, health assistant female, UDC, LDC, lab technician, driver, MTS means sweepers and assistants. So normally 15 staff should be there. Okay, but sometime maybe less or sometime as per need some more staff can also be found in these sub-centers. But for examination purpose you can write these 15. What are the functions of primary health center? So primary health center will cover all functions of sub-centers, but some higher functions are also included. What are those? The functions of primary health center include basic medical OPD services. Okay, while in sub-center there was no OPD because no doctor was there, but here medical officer is there, so OPD services will be provided for all the problems. Maternal and child health services same will be provided here. Family planning services, immunization services to both mothers and children, provision of safe water supply and basic sanitation because it is included in the primary health care, so we will write here. Then prevention and control of local endemic diseases, survey and data collection, this will also included here. Health education to spread the awareness related to health, nutritional status promotion services, national health program activities, referral services and basic laboratory services and the training of ASHA and local staff is also completed on the at the PHC. Okay, so these are the function of PHC. Next higher center will be community health center or CHC. Okay, so CHC is the health facility which covers population of 80,000 to 1,20,000. Normally it is a block area. Okay, according to panchayat system, it is a block area. 80,000 in hilly, tribal and backward area, and 1,20,000 in plain areas. Okay, this is the simple description of community health center. And one more thing about community health center, that it is also known as FRU, first referral unit, because the clients are referred from PHC to CHC first time. Okay, so this is known as first referral unit. We will also discuss what are the referral units or referral system in a separate lecture. Now here at CHC, OPD, along with OPD service, IPD services are also started. So round the clock services are provided. Okay, CHC is open 24 hours. Okay, 24 into 7. So round the clock services starts from community health center. Community health center is equipped with at least 30 beds for inpatient service. Okay, so capacity is at least 30 beds, maybe some more, but at least 30 beds should be available at community health center. And if we discuss the staffing pattern, then staff will be more depending upon the services. First of all, medical officer 4. Okay, 4 doctors will be there. At least one should be from obs gynae, and one should be from child health and medical officer. Along with that, surgeon may be there, or dental officer may be there, orthopedician may be there, but at least gynae and child health, they should be appointed at least. Okay, other doctors can also be. Then, as we know that IPD services are started, so nursing staff will be there, staff nurse, or we can say nursing officer, they will be 7 to provide round the clock services. Okay, then pharmacist, lab technician, radiographer, ANM to provide basic services related to that primary health care services. Then data entry operator 4, dresser, driver and MTS. So total at least 25 staff should be there at a community health center, maybe more depending upon the services provided. If we discuss about the functions of CHC, so again the services which were provided in PHC, they are included, but some additional services will be there. So number 1, routine and emergency care in medicine. Okay, they are started here. 24-hour services, routine and emergency care in surgery as well, because operation theatre is there, X-ray room is there, so we can provide these services. Also 24-hour delivery services for pregnant mothers, this is also provided here. Obstetric care including LSCS operation, these services are also provided at a community health center. Okay, full range of family planning services including permanent family planning, NSV and tubectomy, these are also provided. Child health services, routine as well as emergency, because child health specialist is there at the CHC. Then basic laboratory service including X-ray, ambulance and transportation services are also available. Okay, before this center at PHC these services may not be available, but at CHC ambulance services and driver must be available. Okay. Then implementation of all national health program, these services are provided. Community health center also provide inpatient services to the patient with the provision of at least 30 beds. We have already discussed this. Emergency newborn care, community health center is also known as first referral unit. Okay, this question is asked many times, that what is the first referral unit? So we should answer it is community health center. Okay, so this is all about the how we provide health services in India.